And so we have part 5 of the appendicular skeleton. We're looking at the lower extremity, just finished up with the femur, and now we're looking at the two bones of the leg, and we're considering the tibia and the fibula. So what we're looking at in particular at this point is that the proximal end here, we have these two tables into which the condyles of the tibia fit. And then we have these little projections right there, internal condylar eminences. And you might have heard of the anterior and the posterior cruciate ligaments. And so those are attachment sites there. And they prevent the tibia from moving forward or backward underneath the weight of the body through the femur. Okay, so the femur can rest, and that these ligaments are going to hold it in anterior posterior position. Okay, we're going to learn from joints that some of those features can be, how would I say, traumatized, and we'll see how that works. There's also a big muscle that comes down across the knee and ends right here. It's called the tibial tuberosity. And so this is the end point right here for the muscular tendon that comes down and forms the possibility for extension of the knee. Okay, then we have a lateral feature called the fibula. And the head of the fibula does not play a role in the joint, specifically the movable portion. It does play a role in terms of the ligaments that support the joint. And then we come down here. Here's the anterior shaft, nice and smooth. Back here, we have some features that allow for musculature to attach. Coming all the way down, you'll notice that the tibia is substantial at both of its ends. The fibula is much more delicate, as it were. It's a more lateral feature. Here at the distal end, we're going to enclose a portion of the foot bone that creates an ankle right here. Okay, so there's going to be a portion of this bone right here that sticks up. Okay, right up this way. And this bone referring to as the talus, and then there's going to be this projection upward right there, and it's going to fit right in there, and we're going to have like a little box that fits on it. So we have this feature here called the medial epicondyle. You can touch it on the medial side of your own ankle. It's a substantial bony structure that pokes out. Over here on the lateral side of your ankle, you also feel a bony structure that pokes out, and then in between the two is the formation of that joint, the ankle joint. It's a very strong, simple, hinge-like joint. All it does is extend and extend upward and then extend backward. We have this thing called dorsiflexion and plantar flexion, but at any rate, it's a simple hinge joint. Any other movement at this part of the anatomy is through all of the other bony structures. So technically there is no pronation or supination. It only looks like that, and of course salespeople will try to sell you shoes based on that particular movement of the foot, but actually there is anatomically only a hinge joint here. Okay, if there's more than a hinge joint, you have sprained it badly. Okay, this is an immovable portion right through here, even though this little intramembranous unit right here of connective tissue seems like it would allow for movement. Up here we don't have a movable joint, and down here we do not have a movable joint. So we're in that situation. Here's our feet right here. Here's the top of the talus. Okay, it's called the trochlea of the talus. The trochlea fits up into that little box-like portion so that the lateral malleolus comes on this side, the medial malleolus comes on this side and forms a little box over the top of it. Okay, if you look at the side view here, here's the heel of your foot, right here, the calcaneal bone, and the talus sits on top of it. Okay, and then going from medial to lateral, we have a number of bones featured. The first one up here, anterior to the talus, is going to be this navicular, and then there's a whole row of bones up here called the medial cuneiform and the intermediate cuneiform, and then the lateral cuneiform. So the medial, intermediate, and lateral cuneiform. And then we have a big bone right here, similar to the hamate in the wrist, and this is called the cuboid, and it actually supports two metatarsals in this case. Okay, so we have tarsals, we have metatarsals, and we have phalanges. The phalanges of the foot are similar to the phalanges of the hand, except we've adapted to running rather than holding something, and so our phalanges have shortened up quite a bit compared to our fingers. But we still name this particular phalanx, a pair of phalanges here, which is our great toe, number 1. See the number 1 right there? This is called hallux. Okay, so there's an extensor hallucus and there's a flexor hallucus. This is still indicus right here, so that's going to have the muscles similar to those of the hand. This is still digiti minimi, and it's going to have muscles named for that. Okay, so this is toe number 1, 2, 3, 4, 5. Metatarsal 1, 2, 3, 4, 5. Okay. There's a big bony structure here that comes off of metatarsal 5, and it's actually holding a muscle ending right there. And then there's another muscle that slips into that little space right there. Okay, so it's kind of interesting in that regard. Then you can see how we have an arch-like shape right here. Okay, and that there's going to be a tendon that comes down this way. Some people call it the Achilles tendon, but in anatomy we're going to call it the calcaneal tendon. Okay, we're going to consider here the arch of the foot. And the arch of the foot is sort of a three-point landing that I'd like you to consider. And I would consider that the metatarsal number 1, the metatarsal number 5, and the calcaneus represent that three-point landing. If you see somebody with a very well-formed arch, strong feet, possibly a dancer, okay, somebody who's really exercised, a gymnast possibly, and they're standing barefoot on a polished floor, hardwood floor or something. Oftentimes you can actually see light from the windows streaming underneath the foot because there's that much arch. So we have these two forward arches here, one called the medial longitudinal and the lateral longitudinal, and then we have a transverse arch. So we have this nice springy unit, and it's for the purpose of movement and springing and running. We are, in fact, anatomically great runners, and we can talk more about that as time goes by.